in.
Hi.
Hi.
I'm Sarah. I'm going to be your nurse today.
Okay.
Can I get a name and date of birth, please?
Macy Downs, 010893.
Okay. Raise your bed up here. I'm just going to check your bands here. Do you have any allergies?
Nope, not that I can recall.
Okay, checking allergy bands. All right. Well, Macy, today I'm here. We are just going to do a head-to-toe body assessment. I'm basically just going to start at your head, go all the way down to your toes, and make sure that there's no abnormalities. Everything looks okay. And then we're just going to get a set of vitals. Is that okay?
Sounds great.
Do you have any questions?
Nope.
All right, if you have any questions along the way, just let me know.
Okay.
I'm going to go ahead and start just by taking your blood pressure.
Okay.
Blood pressure. Put on your oxygen. Just going to take your temperature quick. Pull your ear back here. 98.7. Looks good. It's really good. Your oxygen is 98, which is also very well. And your blood pressure is 124 over 66.
Sounds good.
Which is good. Okay. Now what I'm going to do is I'm just going to listen to your radial pulse. I'm going to listen to your radial pulse for 30 minutes. Or for 30 seconds, sorry. And then I'm going to do respirations for the next 30 seconds. Let's see. Feeling the radial pulse. Radial pulse is 64. And your respirations are 18.
Looks good, I'd say then.
Yeah, no, very good. Okay. So what I'm going to do is I'm just going to listen to your heart. I'm going to come over here on your left side. Okay, so I'm going to go left mid-clavicular line, and I'm going to go all the way down to your fifth intercostal space. And what I'm going to do is I'm going to just go under your gown here, and I'm going to listen to it. Is that all right?
Sounds good.
All right. All right, your pulse is 64.
Okay.
All right. Put that up again. Let me turn in and stuff. And actually, your radial pulses were nice and even, and your apical pulse, rate and rhythm, was regular. So that's really good. Okay, so I'm just going to go off and ask you some questions. First of all, I'm going to ask you, where are you? Do you know where you are?
Essentia Health in Fargo.
Okay. And do you know why you were here?
I had elbow surgery.
Okay, which elbow?
My right.
Your right elbow. So this elbow, okay. And then what time is it?
I would say 5 o'clock at night.
Okay, perfect. All right, so are you having any pain or anything in this elbow?
I'm having some dull pain.
Some dull pain, okay. So on a rate of a 1 to 10 scale, 10 being the worst, 1 being not the worst, 1 being not so, no pain, what would you rate that?
Probably like a 5.
Like a 5, okay. And is there anything that you do for the pain?
They gave me Tylenol about an hour ago.
About an hour ago. Okay, so are you willing to just wait it off, or did you need something else, ice or elevator or anything?
Nope, I should be okay.
Okay, perfect. All right, and you said it was a dull kind of pain?
Yes.
All right, so that's your definition of your pain. All right, so what we're going to do is I'm just going to start off in your head. I'm just going to look around your head. I'm going to look in the back of your head. I'm going to look in the back of your neck. I'm going to look behind your ears. Look behind your ears. I'm going to look in your ears. Can you smile for me?
Yep.
Okay. Puff out your cheeks. All right. And stick out your tongue. Perfect. You have nice symmetrical face. And then I'm just going to move down your neck here. Move down your chest. I'm just going to open up your gown here right now. I'm looking for any lesions, any bruising, looking at temperature, color, moisture, integrity. Moving down. Okay, now we're going to start at your shoulders. Just going to go to your arm. Alright, so I'm looking at your arm, looking for color, temperature, moisture, integrity. Looking at the elbows, any cuts, scrapes, bruises, anything abnormality. Looking for IVs, anything on the arms, any cuts, scrapes, temperature, color, moisture, integrity looks good. No IVs, looking at capillary refills. Alright, your refills come in less than 3 seconds, so that's really good. I'm going to go on your other side. Start up here again. Check this chest part. Looking for temperature, color, moisture, and integrity. Looking up here, looking at your arm. Any bruising, temperature, color, moisture, integrity. Looking at the elbow, which is the bony province. Making sure that no scrapes, bruises, dryness, anything like that. You have no IVs here, no IVs in this arm right over here. Looking at color, temperature, moisture, integrity. Checking out the hands. Looking at the hands, checking the capillary refills. Capillary refills return in 3 seconds. So everything looks good there. And now we will move down to your abdomen. I'm just going to lift your gown up. Is that okay? We're just going to check out your belly.
Yeah.
Make sure everything's okay. All right. So, looking at any abnormalities here, checking for temperature, moisture, color, integrity. Make sure skin is intact. Make sure there's no bruising, no lesions, nothing like that. All right. So I'm going to just ask you a couple more questions. When was your last bowel movement?
This morning.
This morning, okay. And would you say you're incontinent or continent, meaning you have to go to the bathroom? Are you able to make it to the bathroom?
Yes, I would say I'm continent.
Continent, okay. And do you wear any products, briefs, any...
Nope.
Nope, okay. All right, so are you feeling any nauseous, constipation, vomiting, anything like that?
Nope. None.
No, okay. Are you able to pass gas too?
Yes.
Okay, awesome. So, when you go to the bathroom, do you go to the toilet? Do you have a commode?
I get up to the toilet.
You go up to the toilet, okay. So you have no catheter, nothing like that.
Nope.
You're able to go to the bathroom. All right. So we looked at the abdomen. Now what I'm going to do is I'm just going to listen to your belly here, and you have 4 quadrants. I'm going to listen to each quadrant for 1 minute.
Okay.
All right. Vowel sounds are present in all 4 quadrants. So that is awesome. And I'm just going to palpate your belly. I'm just going to press. Is there any tenderness when I do this?
Nope, none.
All right. Non-tenderness. No distension. Any pain or anything?
No.
Nope. Okay. Everything looks good then. Awesome. All right. So now we're just going to come down here. I'm going to glove up. When was the last time you urinated?
This morning with my bowel movement.
Okay. All right. And would you say you're continent or incontinent with urination?
Continent.
Continent. Okay, perfect. have any pain, any troubles going to the bathroom or anything like that?
Nope.
Nope. Okay, I'm just going to check your hair area, make sure everything's dry, clean, and intact. Everything looks dry, clean, and intact. Looks good. I'm going to discard my gloves here. Do hand hygiene. Okay. I'm just going to cover you up here. Alright. We're just going to check out your legs and your feet. I'm going to start at your top of your legs, looking at color, temperature, moisture, integrity, looking at your knees, and I'm going to look behind, make sure there's no bruising, no abnormalities, nothing like that. Looking for color, temperature, moisture, and integrity all the way down. I'm going to look at the top of the foot. I'm going to look between the feet. I'm going to check capillary refills. And check between the toes, not the feet, sorry. And I'm going to check the bottom of the foot. And I'm going to check the heel, make sure there's no redness, no open skin, nothing like that. And there is no redness, no open of skin. Everything looks good. I'm going to go around, make sure everything looks good. I'm going to start over here. Start at the top of your leg, looking at color, temperature, moisture, and integrity. Going back down, looking at the knees, looking at any pressure points, making sure skin is intact. Everything looks good. Going down, looking at color, temperature, moisture, and integrity. Look, nothing, no open skin. And then I'm going to look at the top of your feet. I'm going to look between your toes and do capillary refills. Do the bottom of the feet. Do the heels, no redness, no open skin, nothing like that. And then I'm going to check for edema. No edema is present. Right. So I'm just going to ask you a couple more questions. We have to actually do your lungs and stuff, but how do you walk to the bathroom, or how do you get to the bathroom, I should say?
I usually get up pretty independent.
Independent, so do you walk alone?
Yes, I don't use an assisted device.
Okay, so you don't use a wheelchair, a cane, anything like that?
Nope, just ambulate on my own.
Okay, perfect. And then transferring in and out of bed, do you need help with that, or are you independent with that?
I usually get out of bed on my own.
Alright, and what about mobility in the bed?
I usually, rolling and turning.
Okay, yep, rolling and turning, yep.
I'm usually independent then.
Okay, perfect. Alrighty. So now what I'm going to do is I'm just going to have you turn over there since you are independent. I'll just kind of help you a little bit. Okay. So I'm just going to check the back of the head now that I got a good view of everything. And check the back of the neck, make sure there's no lesions, no bruising, nothing like that, no open skin. I'm going to check your whole back before I listen to your lungs, because I'm going to be doing that in a minute. Your back looks perfect. It doesn't look bruised. There's no open skin available. Color, temperature, moisture, integrity. That looks really good and feels really good. So now I'm just going to go and I'm going to auscultate your lungs.
Okay.
And I'm going to do this in the S pattern. And I should come out with 7 sounds. Just take some deep breaths for me, please.
Okay.
Alright, your lungs sound clear. There's no crackles, no wheezing.
Oh, good.
Yeah, that's very good. Now what I'm going to do is I'm just going to gown up here. I'm just going to check your coccyx area. Make sure everything is dry, clean, and intact there. I want to make sure there's no redness. Make sure that nothing abnormal is going on.
Okay.
Okay, so I'm checking. no redness. Skin is intact, it's clean, and it's dry. So then I'm going to discard my gloves. I'm going to do hand hygiene. And then while you're on your side here, are you doing okay? Are you doing okay on your side?
Yes, I am.
Okay, perfect. I'm just going to go down. I'm going to check your skin. I'm checking for color, temperature, moisture, and integrity. Now I got a good view of the heels. I'm going to check the heels again. Make sure there's no redness or anything like that. And everything looks really good. Are you able to roll down on your side again or your back? Okay. Okay. Okay, so now what we have is your spirometer. What this is since you are in bed, you might develop, you're just not moving as much as if you weren't in bed, since you did have surgery on your elbow.
Okay.
This here just helps your lungs, they just keep moving. What you do is we set a little goal here for you, or your doctor will, and you just put this up to your mouth, and you breathe in as hard and deep as you can, and we want you to do this about 10 times an hour.
Okay.
Alright, can I have you demonstrate for me?
Yeah.
Okay. I want you to take a deep breath before you suck in, too. Oh, perfect. Awesome. Alrighty. Well, oops. Okay. Alrighty. Well, I think we've gotten everything.
Good.
Yeah, alright. So, is there anything you need before I leave?
I don't think so.
No? Okay. Well, we need you some fresh water.
Okay.
Here's your spirometer, so you're able to do this whenever. It doesn't have to be back to back. It can just be whenever you feel like it. Here's your call light. My name is Sarah. I'm going to be here till 6 in the morning. And don't hesitate to call or anything.
Okay.
Yeah, alright. So you don't need anything before I leave.
No, I'm okay.
Alrighty. I got you some clean water. I'm going to tidy up your room a little bit. Here, make sure everything looks good. I'm going to lower your bed. Are you comfortable in this position then?
I am.
Okay, perfect. Alrighty. Well, again, I'm Sarah. I'll be here till 6 in the morning, so don't hesitate to call, alright?
Okay, thank you.
Alrighty, thanks.